Inflammatory bowel disease is quite debilitating. It is there in the young, but its incidence is actually increasing in older adults, and that comes with its unique challenges. So there are two. One is Crohn's disease, and one is ulcerative colitis. Usually, it presents with bloody diarrhea, severe abdominal pain, and this can be sort of a repetitive thing. And the problem is, add this to an older adult who might actually be frail, who might have multiple diseases, who is on multiple medications, who is losing muscle. And do you see what the concussion looks like? It looks like a very difficult older adult to treat. To take care of an older adult with inflammatory bowel disease will not be a job of one person. It needs a multidisciplinary approach, wherein gastroenterologists have to work with geriatricians. To a great extent, we'll have to actually involve the dietitian, because ultimately, with multiple medications and with medications for inflammatory bowel disease, the diet becomes very important. There is also a psychological impact. Now, the reason there is because it's a disease which can be controlled. A lot of times, cure becomes difficult, especially when there are a lot of comorbidities. That's why psychologically the older adult has to be counseled that this is where the disease is going. Now, risk factors as you get older, one is frailty. If you are frail, then the risk of inflammatory bowel disease and managing them will be more difficult. Multiple diseases. Unfortunately, a hypertension could have, with a diabetes, with a stroke, with a history of tuberculosis, with a history of cancer. So if all these things come together, the risk of inflammatory bowel disease will increase. Immunity. Now, there is a term which is known as immunosenescence. As you get older, the immunity of an older adult tends to get a bit weaker as compared to maybe a younger individual. The person can get multiple fistulas that by mean is connections which is there inside and outside. So they could be there in the anal area as well, and it's severely painful, especially while passing stools. Now, with inflammatory bowel disease, it's imperative that you do not neglect the symptoms. Show it to your geriatrician, show it to your physician. If needed, you should be guided to your gastroenterologist and get yourself evaluated.